It's nice to meet you. My name is Daniel Waszkowski, or Dr. Waszkowski, or Dr. Dan, as many of my patients call me. I wanted to tell you a little bit about myself and a little bit about my approach to healthcare. I actually grew up in Northwest Indiana. I was born in Chicago, but spent the most of my life on a horse farm in Northwest Indiana. I attended Indiana University undergraduate. It was actually during that time that my best friend was in a severe automobile accident and suffered irreversible brain trauma. And it was the care of those providers that made me want to practice medicine and take care of patients. So since that time, that's been my goal and my passion. And I attended Indiana University for my medical school degree. I then went to California and was in a residency program affiliated with Stanford there for 3 years and practiced for an additional 5 years in California until the birth of my 2 children. At that point in time, I looked around and thought about where I wanted to raise my children and moved to the Northeast, and I've been in New Hampshire ever since. I enjoy skiing and cooking and eating and love the farm-to-table movement that's occurring throughout New Hampshire. I recently took up golf, so any pointers that you have in that way are always beneficial, could be helpful. My goal of your visit here is to make you feel comfortable in an environment that may be frightening or otherwise intimidating. And obviously, I want to help you and want you to feel better. In order to do that, though, I believe it's essential to get to know you and your family and your other providers. I am a believer in coordinated, comprehensive care with regular visits, including physicals, to help promote a healthy lifestyle. We will work together through your issues to find solutions to those that are solvable and support for those that are not. In most cases, I believe simpler is better. Fewer medications, more exercise, better diet. I believe in the opportunity to work on lifestyle before committing to medication. However, medications are important and still need to be considered. I support alternative approaches to health, and although I may not completely agree with all of those approaches, I will work with you to explore other solutions. I take care of patients from birth to death. I've had the privilege of being present with my patients, their families and friends at some of the most difficult times of their lives. I love what I do, and I look forward to meeting you. Be positive, think healthy.